This combination medication is used to temporarily relieve symptoms caused by the common cold, flu, allergies, or other breathing illnesses such as sinusitis and bronchitis. Antihistamines help relieve watery eyes, itchy eyes/nose/throat, runny nose, and sneezing. Decongestants help to relieve stuffy nose and ear congestion symptoms. If you are self-treating with this medication, carefully read the package instructions to be sure it is right for you before you start using this product. Some products have similar brand names but different active ingredients with different uses. Taking the wrong product could harm you. Ask your pharmacist if you have any questions about your product or its use. Cough and cold products have not been shown to be safe or effective in children younger than 6 years. Do not use this product to treat cold symptoms in children younger than 6 years unless specifically directed by the doctor. Some products, including some long-acting tablets/capsules, are not recommended for use in children younger than 12 years. These products do not cure or shorten the length of the common cold and may cause serious side effects. To decrease the risk for serious side effects, carefully follow all dosage directions. Do not give other cough and cold medication that might contain the same or similar ingredients. Ask the doctor or pharmacist about other ways to relieve cough and cold symptoms. When taking Lohist-D, make sure to follow the instructions given by your doctor or the directions on the product package if you are self-treating. If you experience stomach upset, it's okay to take this medication with food and be sure to drink plenty of fluids. If you are using the liquid form, use a special measuring device to carefully measure the dose. Do not crush or chew extended-release tablets or capsules, and if you are using chewable tablets, chew thoroughly before swallowing. If your doctor has prescribed a daily dosage, be sure to take it at the same time each day. Make sure to consult your doctor if your condition lasts for more than 1 week, worsens, or occurs with other symptoms such as a persistent headache, fever, or rash. Common side effects of Lohist-D may include drowsiness, dizziness, dry mouth, headache, upset stomach, constipation, or trouble sleeping. If any of these effects persist or worsen, notify your doctor or pharmacist promptly. If your doctor has prescribed this medication, it is because they have judged that the benefit to you is greater than the risk of potential side effects. Many people using this medication do not experience serious side effects. However, seek immediate medical attention if you experience any serious side effects, including changes in mental/mood, such as confusion or hallucinations, ringing in the ears, difficulty urinating, or changes in vision. In rare cases, a very serious allergic reaction to this drug may occur. Seek medical help right away if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or difficulty breathing. This is not a complete list of possible side effects. If you notice other effects not listed above, contact your doctor or pharmacist. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking Lohist-D, make sure to inform your doctor or pharmacist if you are allergic to any of its ingredients or if you have any other allergies. It's important to discuss any medical history, especially if you have breathing problems, diabetes, glaucoma, heart problems, high blood pressure, kidney problems, liver disease, seizures, stomach/intestinal problems, overactive thyroid, or difficulty urinating. This medication may cause dizziness or drowsiness, so it's important to avoid alcohol or marijuana while taking Lohist-D. Be cautious when driving or using machinery, and limit alcoholic beverages. If you have diabetes, alcohol dependence, liver disease, phenylketonuria, PKU, or any other condition that requires you to limit or avoid sugar, aspartame, or alcohol, make sure to speak with your doctor or pharmacist. If you are planning to have surgery, it's important to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. For children, they may be more sensitive to the side effects of Lohist-D, especially excitation and agitation. And for older adults, they may be more sensitive to the side effects, such as dizziness, drowsiness, confusion, constipation, fast/irregular heartbeat, trouble sleeping, and urination problems, which can increase the risk of falling. If you are pregnant, it's important to discuss the risks and benefits of Lohist-D with your doctor before using it. And for breastfeeding mothers, consult your doctor before using this medication, as it may pass into breast milk and the effects on a nursing infant are unknown. It's important to be aware of any potential drug interactions with Lohist-D. Make sure to keep a list of all the medications and products you use and share it with your doctor and pharmacist. Avoid taking MAO inhibitors with this medication, and be cautious if you are taking other products that cause drowsiness, such as opioid pain relievers or drugs for sleep or anxiety. Also, be sure to check the labels on all your medicines, as they may contain ingredients that cause drowsiness. Additionally, be aware that this medication may interfere with certain medical or lab tests, so make sure to inform lab personnel and your doctors that you are using Lohist-D. If you or someone else has taken too much Lohist-D and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the US, you can call your local poison control center at 1-800-222-1222. In Canada, you can reach out to a provincial poison control center. Symptoms of an overdose may include irregular heartbeat, hallucinations, fainting, and seizures. If your doctor has prescribed Lohist-D, do not share it with others. It is important to keep all medical and lab appointments when taking this medication. This can help ensure that the medication is working effectively and monitor for any potential side effects. Be sure to follow your doctor's instructions carefully for the best results. If you are using this medication regularly and miss a dose, take it as soon as you remember. If it is near the time of the next dose, skip the missed dose and take your next dose at the regular time. Do not double the dose to catch up. You should store Lohist-D at room temperature, away from light and moisture. Avoid storing it in the bathroom, and don't freeze the liquid forms of this medication. Always keep all medications out of reach of children and pets. When you no longer need Lohist-D or it has expired, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for the best way to do so. Avoid flushing it down the toilet or pouring it into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.